Welcome, Saratoga. Welcome to our Sunny Side Up morning show. Today, we have a couple of things I wanted to talk about. First, as always, I'm going to go through the local data on COVID-19, and then we will talk about the new county order that'll take place on Friday. And then we have a special guest from the Valley Medical Center Foundation who's going to talk about everything that's going on there. So, let me just jump into data because everybody knows I watch the data very carefully. Um, a lot is going on in the nation, and well, first let me acknowledge there's a lot going on in the nation related to civil unrest, and our hearts go out to everybody who has been affected. And I will say that if you haven't been affected, you have been affected. We as a society need to cure and solve some of these unfortunate evils, and now is the time. And so we are going to pull together. I don't have a plan or a path forward that I know will work, but I have a bunch of ideas, and we all have good ideas in our heart. And we're going to translate those into positive and peaceful action. So on COVID-19, our nation has been under that for a while here, but collectively we have come together, and overall the numbers in the nation are declining. The state of California, unfortunately, is not quite as lucky. And I've mentioned this before. California is one state, but two major geographies. The Bay Area was hit first, and we responded, some of the first counties in the entire nation to respond, and we did a good job of getting things under control. Los Angeles area, Southern California lagged in their response just by a little bit. But for a whole myriad of reasons, they have a significant number of cases. So when you look at California, we're looking at about 118,000 cases total. You look at Los Angeles, there's 57,000 cases just in Los Angeles County. I know they're big, they're 10 million people, but Santa Clara County, we have less than 3,000 cases, and we have 2 million people. So there's a different dynamic going on. In the last 14 days, there have been only 300 and something cases in Santa Clara County, but 17,000 cases in Los Angeles County. So almost 90% of the cases are south of San Luis Obispo in our state right now. And so I believe it's a challenging time if you are in Southern California. So we have a couple of slides here. Let me see if we can put up. So at the county, our county has provided a landing page for everybody. We have our city landing page, which I'll show later, but we have the county landing page that talks about all the data that's going on within the county. We talk about testing. There's some stuff coming up on contact tracing. It is a wealth of resources that are there. And everybody asks me what my data source is. So I'm going to take over the screen for a minute here. And hopefully everybody can see this well. I use the county dashboard, okay? The county dashboard has a wealth of information, and I'm going to go through some of the main screens that I'm using to determine what's going on. So this is one of the first data things on their website. And it's interesting because they track our COVID-19 cases from the beginning. And you can see we had very few cases and not a lot of testing in the beginning. And then it ramped up rather dramatically. And as we went through April, the rate of change slowed, okay? They have every day here, and if you do hover over it, it will give you the exact case totals for those cumulative for the day. On the bottom, they give us number of cases. Okay. Now, what's interesting and unique about Santa Clara County is that we don't track how many cases were reported on a day. We track based on the date that they actually took the blood sample. I mean, the back of the throat sample. And so that gives you a much more accurate measure of what was circulating in the population at that time. But you can see we had a peak in April, and we sort of got things under control. As we went into May, we started opening back up. And as we started opening back up, we got a little bit more new cases, okay? So this is part of the data the county health department is looking at very, very closely. Can we reopen safely? And this is going to fall to us. We talk about social distancing, but the whole set of protocols, personal contact, contact with hard surfaces, and through the air are the ways that this disease is transmitting. And so if we're going to have more open businesses and more open contact, we have to be super mindful of the social distancing and the protocols for not bringing this infection from the environment around us into our bodies. So we talk about not touching our nose, face, eyes. We talk about washing our hands. So when we go out, we come back home, the first thing we do is we wash our hands, the 20 seconds soap front and back. We got a whole protocol. And I'm sure you do too. When we're out in public, we all wear our masks. It's this peak that they saw after we opened up that made people nervous in our county. To open up, we're going to have to figure out how not to spread this, okay? We did an exceptional job as a county getting this under control, and as we open, we're going to have to be ever vigilant. Okay, another bit of data I wanted to show. This is the hospitalization page. If you notice, there are very few COVID-19 patients in our emergency rooms. I won't dwell on that page. Here is our testing page that shows our cumulative tests per day. I will talk about that in a minute. But I get a lot of comments, particularly in Saratoga, about our long-term care facilities. And this graph illustrates what's going on countywide. In the beginning of April, there was a large expansion of cases in the state of California and in our county in long-term care facilities. But these are very closely managed and regulated facilities, and you can see by the middle of April, they had all instituted very tight protocols to get this under control. And by the end of April, there have been, virtually no new cases showing up in our long-term care facilities, okay? This is exceptionally important because, as you know, our senior citizens and those with other underlying health issues are those that are most likely to die from this virus. And so everybody always wants to know, where am I getting my long-term care facility data? It is right here on the county website. And again, you can see just by this graph, the problem they had, and then the remarkable response that the care facilities in our county took to get this under control. They've done an exceptional job. So what does that mean? We had 17 new cases today. Where did they all come from? One of them came from a care facility, and 16 of them came from the county as a whole. And if you have a loved one in a specific facility, there is a link here. You can look up individual facilities. They do not report individual cases per facility. If there's some activity, but less than 10, they just say it's less than 10. But you can certainly look up all the facilities in our county. Okay, so enough with those slides. Let me talk about testing. The county has had a goal of being able to complete 4,000 tests per day by the end of May, and almost a week early they achieved that goal. So we have in the county today the capacity for more than 4,000 tests. Kaiser's regional test facility in the East Bay, which will service all of Northern California, is coming online in the middle of May and middle of June, and by the end of the month, they will have capacity for 10,000 tests in Northern California a day. So we have met the governor's goal of 60,000 tests a day statewide, and we met our internal goal of 4,000 tests a day for the county. But this is not the end. This is a minimum threshold for certain types of opening. And so they are continuing to aggressively expand testing. They've changed the criteria. If you are in contact with people, an essential care worker, and I don't mean just police and fire and medical, if you're a grocery worker, if you are in one of the businesses that are opening up, you can get a test within our county. They are free. And there is a health department goal to increase the number of people being tested, even if you don't think you have the symptoms. Kaiser's lagging a little bit, but you can still call Kaiser and make your case. And I'm imagining over the coming weeks, they're going to increase their amount of testing as well. So I think I've talked about most of the key data. What's the big takeaway if you're a citizen in our city? There is no cure for this virus. There is no vaccine for this virus. And if we don't exercise caution, the virus will take off again. And we may be strong enough, or our children may be young enough that it'll just be an awful experience. We have a significant number of seniors and citizens in our community with other health conditions, and for them, this could prove fatal. And so I quote Sarah Pearson from one of our local churches. She always says, "Love thy neighbor by wearing a mask." So we're trying to make sure that we're not getting it, but we're also trying to make sure that we don't spread it to somebody else who may not be as healthy and able to fight off this disease. Okay, again, we've done an extraordinary job in our county. Keep it up. Saratoga's in a great position. Keep it up, Saratoga. Oh, on that website, I totally forgot to mention, if you want to see all the data by zip code, you can actually type in individual zip codes and find out exactly how many cases are in each unique zip code. Okay, with that, let us bring up, what do I got? Health department. I think what we should do is we should talk about the new order. So we have our city manager, James Lindsay, with us. If we could bring James in.
Good morning, Howard. Good morning,
Hey,
everyone.
James. So the county's on a cycle where they are making changes. They're assessing the data for 2 weeks, and then they're making further adjustments. And the county is in the middle of stage 2. And on Monday, they announced new openings within the county, which will translate directly into Saratoga. Do you want to summarize some of those big changes for us, James?
Yeah, that's a great transition, because much of what is in the revised order will have significant benefits to our small businesses and our local economy here in Saratoga. When we look at how important restaurants and dining are, well, we've had some of our restaurants transform into takeout service. They can now do outdoor dining following the protocols established by the Public Health Department. It's very exciting to start seeing in-store shopping now available to our stores. And I think probably the biggest thing for our families here in Saratoga and those with kids that have been in the shelter-in-place condition all these months is to see the childcare, summer camps, summer school, all of those opportunities now opening up, again, safely and with the right protocols in place. So I think we're definitely going to see our recreation programs get a boost, be able to get folks outside and active. And Howard, that watch that you were waiting to get repaired, you can now go get it repaired, because now watch repairs, shoe repairs are all allowed as well. So good news all around for the local economy.
So a lot of our businesses were very, very hard hit. And some of them may not actually be able to reopen, and it's hard for me to know, but a significant number of our businesses are ready to figure out how to reopen under these new rules. And so we should expect to see more businesses open on Friday would be the earliest, but in the coming week.
Yes, so everyone, please do continue to shop local and support our local businesses.
Yeah, excellent. And then on the summer programs and summer camps, we had on our show 2 organizations that provide a bunch of summer camps locally. One is Montalvo, so art programs and some other very interesting stuff. And then the Saratoga Los Gatos Recreation Department, they're standing up their summer programs, the ones that can be safely done. A lot of outdoor activities for both organizations. And so if you're looking for summer camps, those are the 2 most immediate local ones.
That's right.
We didn't talk about in-home services. But A lot of us have had gardeners. Gardeners were enabled a couple weeks ago, so hopefully everybody has their gardener back. For those who were using house cleaning and other services within their home, that stuff is all available as well. And
And
then,
pet grooming.
yeah, it is the tough time for our dogs and stuff as they go into summer. A lot of us like to get their hair cut a little bit short to keep them a little cooler, but also to keep the insects away from them and to keep them from getting burrs in their furs. So that should be pretty good. Small gatherings, that's changed too. So we now are allowing the county. I shouldn't say we. The county is allowing outdoor ceremonies and religious services with groups up to 25.
Correct.
So, so on the real positive side for that is, I think this means you can have the small graduation party of 25 or less, provided you can maintain social distancing. But you can have a wedding, you can have a bar mitzvah. Again, these are going to be smaller than some of the large things that people like to do, but it is a move in the correct direction. And I believe that Coney Gardens is going to work themselves into a position of allowing weddings for 25 or less per this order.
I
So
just heard that yesterday as well. I thought that was great news for Hakone too, and for the community and those that have been waiting to have ceremonies, that is now an option for folks. So yes, that is
yeah,
great.
so for those who are in love and can go with a small gathering, I am super grateful that that's going on. In our city, we've had the parks open for a long time, right, James? Tell us what's going on with our parks.
So yeah, parks have remained open, the entire shelter-in-place condition. Restrooms remained open and cleaned appropriately. Under the one or two revisions of the order, we were able to open the tennis courts, so those remained open. I did get word from West Valley College that under these revisions, they'll be opening up their tennis courts to the community. And of course, our trails have been open the whole time. And again, folks are practicing the appropriate social distancing. But yeah, all of those remain open. The playgrounds remain closed. I think we are waiting for further direction when is the right time to be opening up the playgrounds to the community, but those remain closed at this time.
Yeah, it is difficult, when we have our young kids. You take them to the park, they can hike and they can play, but they can't use the equipment. And it is very hard as a parent, but I have to implore all parents, please try to follow that protocol. You don't know which set of kids have been on those hard surfaces, and those viruses can last for a couple of days. And I just don't want our gym equipment and playground equipment to become the medium by which we're spreading the virus here in Saratoga. So out of an abundance of caution, please, I know it's hard with your children, but please try to stay off the equipment. But I will say you can hike in Quarry Park, and there's tremendous amount of space and all of that. And I mentioned at the beginning of the show, opening doesn't mean that social distancing has gone away. Opening doesn't mean that all the protocols we've been learning over the last 2 months for sanitation and if we don't feel good, staying away from others, all of those have to apply. The only way this works of opening is if we maintain that distance and we maintain that personal safety. If we let our guard down on that, the virus will take off again, and we will be talking about hundreds of cases a day, which means that the death rate will go up, and that's not something that we really want to have. James, in the City Hall will remain closed at this time, but we figured out how to run all of the essential services. So could you run us through what's going on at the city?
So absolutely, the infrastructure, streets, parks, maintenance are continuing as they have been for a while now. We have also been able to open up our permit center. We call it virtually, but we have been accepting by appointments on an as-needed basis. The doors remain locked to the permit center unless you have an appointment. So, but the permit activity for home remodels, building new homes, any new construction is all allowed, and we are continuing that process. Unfortunately, the other public lobbies in City Hall remain closed at this time. We hope that will change here in the coming weeks, where we can be able to open those doors to the community. And then we'll be working very closely with the Wascata Saratoga Recreation to see what we can do on the community center side as they start offering classes again to the community. So.
Okay. And then the Santa Clara County Library District, they are working on some protocols to allow books to be picked up and then returned to the library. The libraries are not open. I didn't mention it, but county staff, there's a lot of county staff, think librarians, but hundreds of others whose job function involves the public that has not opened back up. And just so everybody knows, the county has diverted, as of last week, 216 of their employees to the duty of contact tracing. So we are building up the capability for contact tracing, and I just mentioned it because my daughter's a librarian, and she has been redeployed as a contact tracer and has already received training. And so we don't have city employees that are just sitting around, or county employees. We're trying to move them to where they can be most effective and most useful in this situation. So I want to talk a little bit about local resources, and I think we have a slide for that one. So within our community, we have our senior center, and I wanted to put that up. If anybody is a senior and they need help getting groceries, they need transportation to the doctors, they need somebody to help them with their tax returns. Our senior center has ramped up months ago and is providing all of those services. Here's their website, and then they have the phone number 408-621-7526. If you want to volunteer to help with the seniors or to donate, you can find that information on their website as well. And then serving our community is West Valley Community Services. They provide for all people in need. They provide food. We have our local food bank on Wednesday at West Valley College, but they also have resources in Cupertino for those who are in lost their job, difficulty with rent. They provide rental assistance. They provide a bunch of services. If you are in need or know somebody, please direct them to West Valley Community Services. And then I always mention it, and I'll mention it again at the end of the show. We got to save our local businesses. And our Chamber of Commerce has an exhaustive directory of all the businesses in Saratoga, not just chamber members, but all the businesses that are open and operating in their hours and under what conditions and parameters. And so last week I asked everybody to visit frequent a local restaurant and grab something and take it home. With this great weather, maybe it's a grab and go down to Wildwood Park or to Blaney Plaza. There's a couple of nice places to eat outside and make an evening or an afternoon of it. And so please frequent our local businesses. Okay, so next slide. So next up, and I mentioned this at the beginning, it's a real pleasure. Today we have Chris Wilder from the Valley Medical Center Foundation with us. And here's their website, vmcfoundation.org. What a lot of people might not realize in Saratoga is Valley Medical Center is one of the largest and most capable trauma centers in the entire state of California. And if you are in a major accident or something, everybody's thinking, oh, I should go to El Camino. But it turns out that Valley Med has one of the top rated trauma centers in California, and the best one that I know of in Northern California. And I will speak just personally. My nephew was in a tragic accident on a motorized bicycle without a helmet. And they took him, fortunately, to Valley Medical, and 11 hours of surgery with 2 surgeons, they actually saved his life. And so for trauma injuries, there is no better place than Valley Medical, and I speak from personal experience. But I digress. The medical center has exemplary medical staff, but the best part is they have an amazing foundation that supports all of the activities there. And Chris Weiler is their executive director. Welcome, Chris.
Thank you for having me, Mayor Miller. You're very kind, although I'm not certain that the foundation is the best part of our county's amazing health system, but we like to think we're an important part.
Definitely important part. So I know from a consumer perspective as a citizen what a great hospital that we have. But you know it from the inside out. Can you tell us a little bit about Valley Med in general, and then we'll talk about the foundation?
You bet. And I can speak, really from my standpoint of how did I get here 18 years ago? Why have I run this foundation that long? And it's because, like a lot of people, I didn't know very much about Valley Medical Center then. And I can't speak officially for the hospital, but I can sure tell you what happened to me when I first came in and saw it. I was blown away. I couldn't believe the quality of the services, the breadth and depth of services that were offered. And what I learned, and what a lot of people have learned since, and what I try to tell everybody I meet is, regardless of where you get your regular health care, you or someone you love, one of these days is going to need Valley Medical Center. You said it yourself, Howard. We operate a top-level trauma center. We're the only level 1 trauma center in the city of San Jose, and in my view, one of the best in California, as you mentioned. Our brain injury and spinal cord injury programs are second to none. We provide an incredible neonatal intensive care unit. For the stats that I've seen, I'll bet we're the safest place to have a baby in the entire state of California. But the reason people don't always know that is because we're also the safety net. Santa Clara Valley Medical Center since 1870 has been the safety net for this community. And that's actually expanded. You may remember that last year, Santa Clara Valley Medical Center and the County of Santa Clara purchased 2 other bankrupt hospitals. So they're now being run by the county, and that's O'Connor Hospital in San Jose and St. Louis Medical Center down in Gilroy. So this makes up the county's healthcare delivery system from the hospital standpoint, and we're proud here at the foundation to be the fundraising arm for all of those institutions. And of course, during the COVID-19 crisis, our role, I think, expanded beyond what any of us ever could have seen coming. And it has been exhausting. It has been inspiring. And people in Saratoga, we're just so thrilled for those of you who have helped us and for those of you who may help us in the future, because although we're not out of the woods yet, I think we're doing a pretty good job finding our way through the woods.
It's not unexpected, but an unfortunate situation that we found ourselves in. We all knew someday we would end up in some sort of pandemic situation, and you can prepare and you can think that you're ready, but it's always a challenge when it comes. And that is my observation for this situation, because I know firsthand that Valley Med was ready for this, but I also know that it was still overwhelming when it got here. So
it was, but I gotta say though, you said it in your introduction. We've done a great job of sheltering in place and of using masks and hand sanitizers and 6 feet apart. All of those things have made an incredible difference. That's one of the reasons we didn't see the surge that we were all terrified we might see. And then the other reason that we've been so prepared is because this valley has been so generous, and the donations have come in our door at a rate that we've never seen. Boxes and boxes and pallets of PPE every day, every week for the last 2.5 months. It's been wonderful. And the dollars that we've gotten have allowed us to be really, really nimble and pivot where the needs are. So it's really from an individual standpoint, people have done the right thing. And from a community standpoint, wealthier individuals and companies have been extraordinarily generous, and we're in a really good shape as a result.
Valley Med is so well known. I know several large companies that have delivered some from their own stock PPE in bulk to the foundation. And
well, you used to work for one of them, actually. Apple has been extremely generous.
Do you have the Apple designed face masks, face shields?
I actually do. They have provided us face shields. Other companies like Google and Intuitive Surgical and so many. You know, I'll start down the rabbit hole of naming companies, and I know
Okay.
so many. But I really have to give a huge shout out to the Silicon Valley Leadership Group and Carl Guardino, their CEO. When this crisis hit us, Carl was right there making the asks of his members and their leadership. And that's where the lion's share of our response has come from. The members of the leadership group have been extremely generous. The executives of these companies have been giving, the companies themselves have been donating. And yes, sometimes it's PPE, sometimes it's dollars, sometimes it's both. And some companies have even said, you know, if we're having trouble finding things to have you purchase, let's pivot our manufacturing and let's start making these things. So, you know, again, Silicon Valley is sort of uniquely positioned to respond well in a crisis like this, but it doesn't happen without people already being naturally generous. We've got a lot of generosity here, and I'm so proud and so thankful.
We got a lot of people in Saratoga that want to be able to help. So how can my citizens get engaged to help Valley Med?
Well, the easiest way really is still with, you know, with basic dollars. Again, making a donation to the VMC Foundation ensures that we're able to keep up with the need. We are not running out of things right now, but there are some items that are in short supply. And every time I turn around, there's a new request from our command center and from the County Office of Emergency Services. You've been referencing their work, which I think is just exemplary. And we've been working with them to purchase items to keep the testing going. We've identified a lot of test swabs, but really it takes money because sometimes we find out about a particular resource, and if we don't jump on it right away, we'll lose it. So the fact that we're able to offer so many tests countywide is really a testament to the generosity. So if you visit our website at vmcfoundation.org, that's the easiest way to donate. And now that restaurants are beginning to open, I think that it doesn't mean that people shouldn't support them to the greatest degree they can. One thing folks can do is to call us up on the phone at 885-5299 if you would like to support your local Saratoga restaurants in providing meals for our frontline healthcare workers. That's still a great need.
Oh, excellent. I had not even thought of that. We have a lot of organizations and students and middle school students. My own daughter who've taken to sewing masks. Are you guys still accepting hand sewn PPE?
We sure are. It's been so much fun to watch, especially young people coming together to do that. I've got a good friend who, she's only 19 years old, and she and her brother have amassed an army of people who are sewing all around Silicon Valley. And we've received thousands, tens of thousands of these homemade masks, and they're really just flying out the door. They're going to our frontline healthcare workers. They're going to the staff all over our county health system. You know, there's only over 10,000 employees here, but we're helping everyone from the healthcare workers in the jails to the clinics to the behavioral health services folks. I say if you are sewing, keep it up. We are not out of the woods yet. We still need your expertise. We need your talent. Believe me, if you gave me a sewing machine, I wouldn't know what to do with it. So we need you.
Oh, excellent, excellent. Hey, so hospital services sort of, the hospital is never a place anybody wants to go to in general.
Right, right.
But a lot of the services sort of shut down as we went into the virus. Is the hospital more open at this point?
You know, what I can say is that I received, because I'm a patient at Valley Medical Center myself, I wouldn't have it any other way. I got a letter in the mail yesterday from our CEO, Paul Lorenz, and the letter was saying Valley Medical Center and St. Louis and O'Connor Hospital are open for business. We are here to serve you, and we're here to serve you safely. And that, I think, was a really powerful message to send out. There are people in our community I know who are deferring medical care that they need. That's not good either. When I hear about people who really need something and really need to see their provider, or in fact, maybe need a procedure done, and they're afraid to come to the hospital, well, I get that. But I also know that if you're not taking care of yourself, you're not doing yourself any favors long term. So knowing that our county health system is here for you is very important. I think other hospitals would probably say the same thing. But in general, I think, Mayor Miller, you're right. Hospitals are no place for sick people, and you want to spend as little time in them as you can. But we're all here because things happen beyond COVID-19, and those services are absolutely being provided at our three hospitals here.
At this point, COVID-19 hospitalizations are the lowest they've been in 4 or 5 months. And what's interesting is all the hospitals have procedures and ways to identify and deal with those patients in a super safe manner. And if you've been to a hospital lately, the protocols are quite amazing to just even get in. Everybody gets their temperature taken and you sanitize and everything. And so I gotta say, I've always been nervous in the hospital sitting next to the guy who looks super sick and coughing. And the world has actually changed in the last 4 or 5 months. You actually don't see that anymore because we're much more responsive to isolating anybody who could be sick. So
That's right. And we also are taking the temperature of each and every staff person before they go to work at any of our hospitals or clinics. I have my temperature taken here at the foundation every morning. And in fact, our foundation, with some of these generous dollars that people have given, we just bought these amazing devices that will actually take the temperature of a room full of people all at once. So it
wow.
makes that process way more efficient. And all of those staff members we used to have lined up taking people's temperature by the hundreds, thousands every day, we can actually have them go back and do more of their regular work that they were assigned to do. There are so many people, Howard, who are working jobs that they did not specifically set out to work in the past couple of months. We've got this amazing hospital system full of talented people, and a whole lot of them are doing stuff that isn't their regular job. So these devices allow people to return to work in the way that they, number one, want to do, and number two, that we're going to need to do as this epidemic hopefully comes to an end and people begin to return to receive those procedures that maybe they're deferring right now.
Yeah, I'll make the shout out. Please be in touch with your doctor if there's anything going on. Um, we have the top medical care in the world and some of the best possible medical care right here in Santa Clara Valley. And if you have any sort of lingering medical issue, don't defer it because you're afraid of this virus. Get in touch with your doctor. There's all sorts of things that they're doing differently to make sure people are safe. So Chris, go ahead.
I was gonna ask if I could talk for a minute about our frontline healthcare heroes.
Oh,
Um,
yes.
because the immediate response of this valley has been to ensure that we have the medical supplies and the PPE and the amazing technological devices so that we could provide the care. What has been slower in coming is recognizing how painful this has been for our frontline healthcare workers. You may have read some of the reports. Our doctors and nurses and people on the front lines are scared. They are exhausted. They are angry. Many of them have been isolating themselves. We had a program at our foundation where we were providing, and still are, hotel rooms for people who don't want to risk bringing COVID-19 to their homes and their families. And so there's a lot of isolation and fear and stress like most of us can't imagine. In fact, there are experts who say that there are healthcare workers across the country who are exhibiting symptoms exactly that of a soldier returning from war. So one of the ways that people can help if they wish is that we've just developed a program in partnership with 1440 Multiversity in Scotts Valley. They're a beautiful world-class retreat center. They were created and founded by the former CEO and chairman of Juniper Networks. And we've developed a program and a curricula where our healthcare workers can go and they can spend 2 days in a wonderful, relaxing and healing environment where they can actually take classes and seminars and trainings that help them in this time of crisis. And then they're provided a year-long program afterwards of online support and therapeutic services. When I first brought this idea up to some of our frontline healthcare workers, there was a lot of emotion, and they said, how do we sign up? How can we make this happen? So we're just launching the program now. It's called Healing Our Healthcare Heroes. And if people want to learn more about it, they can call our foundation or they can call 1440 Multiversity. It's really an amazing place. I don't know if you've had a chance to go there, Mayor Miller, but but what a resource in our community, and something that I think can be replicated around the country. It's not just here, it's all over this land of ours, that healthcare workers need healing.
Yeah, well, it is such a challenging time. And, you know, on behalf of all the citizens of Saratoga, I want to say thank you to the staff and the frontline workers and the behind the scenes workers um, at both the foundation and at Valley Medical Center. These are the hardest possible times to be operating under, and you guys have done an amazing job for our citizens. And I want to express our profound gratitude to all that you've done and all that you guys are going through on an hourly and daily basis. And, you know, we are the community we are because of your people. So thank you. And thank you,
Well,
Chris.
I'll pass the sentiments along to the executive leadership and staff. Again, you know, my job is really just to cheerlead and raise money. I'm in awe of the quality and the perseverance of our staff, just like you are. And I'm just like you, I just feel so lucky that we were able to live here and experience this level of care and concern for the communities around us.
Great. Okay, so let's wrap up. Let me put back up your slide for the contact information. So Chris, tell us what people can do if they want to get involved, and give
Well,
us the phone number again.
we've really repurposed our website to talk about our response to COVID-19. So the website's a great place to go and learn how you can help. But if you have a specific question or a specific idea, our phone number is 408-885-5299. We'd love to hear from you. We'd love to work. And you know, our North Star, Howard, is always donor intent. So if you have a specific place that you'd like your dollars to go and benefit, then tell us that and we'll work to make sure that takes place.
Okay, excellent. So if you want to donate masks, if you want to send a check, if you want to be involved, here is their website again, vmcfoundation.org. Chris, thank you for being with us this morning, and I know you have important work to continue, so thank you for spending the time.
I appreciate the opportunity, Mary Miller. Thank you.
Thank you, Chris. Okay, so I have just a couple slides to wrap up here. Next slide, please. There we go. So we have our city resource page. If you want to find out about all that's going on within our city with respect to COVID-19 and other things in the city, here's our city resource page. Please go there to find out a wealth of information. And then I want to talk about, next slide, please. So I mentioned this before, but if you're a senior and you're in need of support, please contact our senior center. They are helping people buy food, get to appointments, sort out technology issues, sort out tax issues. They are there and they need volunteers and they need support. And then for those who are having issues just with the insecurity of rent and food and utilities and this basic essentials of life, West Valley Community Services is serving our community. They're supported directly by the city and by a myriad of volunteers and generous donations from citizens throughout the region. So West Valley Community Services, we do continue to run the food bank at West Valley College on Wednesdays. And then there are other food banks in the region that are easily accessible. And then last and very important, especially with the new changes this week, please support our local businesses. Without a concerted effort on the part of all citizens to support local businesses, they may not be there when we come back completely. So please visit the Saratoga Chamber website that's listed here, and find a business and find a way to get a meal. And if you don't want to do the picking it up, Chris mentioned there is a process by which you can donate a meal to the frontline workers at the Valley Medical Center. So there are other options and other ways that you can support our local businesses and support other charities within the area at the exact same time. Okay, so that's what we have today for our show. This show will be rebroadcast tomorrow on KSAR, and it will be posted on the city's Facebook page. So thanks for being with us.